Thank you for choosing Lake Medical Hearing Center for your hearing health care. Today, I wanted to go over our portal so that you could see how to get logged in. Now, in our website, lakemedicalhearingcenter.com, on the top right, you're going to go to Patient Portal. Once you click there, you're going to get this particular login screen. Now, there are two ways to get logged in. There's one, register. So if you're a new patient who has not been in the portal before, okay, or even if you're an existing patient but have never signed up for the portal, the first thing you're going to do is you're going to click register now for free. In that, you're then going to have all your registration information is requested. The reason that it does this is because we do not pre-register patients for portal access. If it is something that you want, you are creating your own username, you are creating your own password. It is not information that we have. This portal information is just for you. It is not something we see on the back end. The email address that you want to use is the email address that you provided to the office when you initially scheduled your appointment, or whatever it is most updated to, because sometimes they change, right? So you'll put your email address in that's on file with the office. You're going to put your last name in that's on file with the office. In our office, your last name in our system must match your driver's license and your insurance cards in order for your insurance claim to process. So that's always going to be what it is. Whatever's on your driver's license, however it's spelled or hyphenated or whatnot, that's what it's going to be here as well. Under the date of birth, now this one is a little bit funky. As you can see, when you click it, you get the year pop up. The reason for that is that the system does require all 8 digits in order for it to be a valid date of birth. So they changed it to this so that you can go back and click the year. Say we was born in 1903 in January on the 9th, okay? And it's going to go back and it's going to add in all of the requisite zeros that you need. For instance, January is 01. The 9th day of the month is 09. So that's why that box pops open like that. And it's a little bit weird. Now, can you go back in and you can type into it? Sort of, but they kind of really made that difficult on purpose to make it so that it gets the right format. Then you're going to enter your registration code. Your registration code is generated automatically by our medical records system. And if you have lost that code or need that code, certainly let us know. That code is something that we send in an email. So you do want to check for a registration email that is going to have that code in there. The username and password is going to be what you create it to be. You can create it to be whatever you want it to be. This is not something that we can go back in afterwards and see and or change. So you do want it to be something you are going to remember or something that you write down. Now, cautionary note, do not use the same password on your health portal as you do for your financial data or any other things like that. Using information like that can be very, very risky, and it leads to the potential of somebody being able to get into your account the more websites it's on. So you do want to use a new password that is unrelated to anything else that you do financially. Once you have all of these boxes filled out, you're then going to click register, and that should move you onto the next screen so you can get into our portal. Once you've registered, if you want to get back into your portal, you would actually come to the patient portal button here at the top right, and you're going to come to log in. You already have a username and a password that you personally have created. So now we're going to click log in, and then you can put in that username and password. As you can see, my personal one populates automatically because of my settings on my computer. You can do that or not. That's up to you. If it's a public computer, certainly don't be doing that because you don't want somebody else to get in and see your medical records or your health information, things like that. So hopefully that helps everybody with that portion. And I will do another video about navigating the portal here in just a little bit. So go ahead and look for that as well. Thank you so much. You have a wonderful day.